So what you been doing on your time off, man? I mean, just you probably don't even listen to any shows anymore. You're just probably just like you probably have a real life now.
You know? Well, I don't know about that, but haven't been listening to any shows at all. So if I haven't listened to your show, or if you're listening and I haven't listened to your show, if you're listening, it's nothing against y'all. It's just I stepped away from the blog talk for a while, and still kind of stepped away. I'm not really back. But I've been working, and for the last 3 months, I've been working on this dietary program that I have to be on for 6 months. And matter of fact, I go to see my nutritionist Monday for my fourth visit, and then after that, I've got two more visits to go. And then once I get to that last visit, then I can schedule my surgery. So we're kind of shooting sometime August time frame for my bariatric surgery. And while that's I guess a little intimidating and scary, I suppose it's exciting at the same time. So that's pretty much what I've been doing, just kind of trying to change some lifestyle habits, and trying to do things a little bit differently, and been kind of hanging out with some people from work, and doing the B-Dub thing, and of course spending time with the kids. And I've got both an Xbox and a PS3, so I've been doing a little bit of gaming and stuff on the side too. So I try to keep busy, watching TV, watching American Idol, stuff like that. So I keep busy, doing other things instead of listening to shows and things. So yeah.
Well, that's good. Yeah, I didn't really want to get into it unless you talked about it there, but yeah, that's an interesting journey that you're on right now, and I know that you and I have kind of talked about it in passing, over the past few months when we've gotten to chat, and so it sounds like you're on the path there now. That so the program you're on is 6 months on this thing, and I presume you check in with them, or they check in with you every so often just to kind of see how it's going, and that type of thing.
Yeah, about once a month I meet with a nutritionist, and we go over. I keep a food journal of everything I eat every day, and we go over what I've been writing in the food journal and stuff, and talk about the things I've been eating, and making better choices and things like that. And of course, eating certain things, which the diet's actually just a high protein diet, lots of meats and cheeses and things like that. Because once you actually have the surgery, everything kind of passes through you so quick that the protein is real important to have, because look at this. I really don't know what the reasoning behind it is, but the protein kind of keeps you healthy, and makes sure you're getting the right nutrients and things like that you need. And obviously, if you're not getting enough protein, I guess after the surgery, it's real easy for you to possibly even have a heart attack. So they want you to eat at least 72 grams of protein a day. So of course,
Well,
water is important too. So yeah.
and I've had some people that go through the surgery, and even before they have the surgery, they have had some weight loss because it's a whole change in lifestyle. Have you had some weight loss since you started the program here?
Well, the last time that I had went to the doctor, I've lost about 11 or 12 pounds altogether so far, just on the being on the diet. So I'll find out tomorrow if I've lost any more. I've noticed a little bit change in some of my clothes. Some of my clothes are a little bit looser than they used to be. So
Mm-hmm.
it's not a drastic weight loss, obviously, but it's a little bit. Every little bit counts. So it's less I got to take off later.
Yeah, but I presume you're feeling a little bit better. You got more energy, that type of thing.
Yep. Yeah, I've been, we've been going with one of the ladies from work. She's got a little 2-year-old boy, and my daughter, and I'm going to take my son tomorrow, and I think we're going to go to the park. And we've kind of been hanging out at the park on the weekends for 2 or 3 hours, and, trying to do a little bit of walking and stuff, and, just trying to do a little bit of moving around and a little bit more exercise and stuff than, what I'm accustomed to. So that's a big lifestyle change, too. So.
Mm-hmm.
Well, there's actually 3 different choices. At least I think there's just 3. At least there was 3 the last time I had actually talked to the doctor. There's the actual gastric bypass, And then, of course, they have what they call a sleeve, which it's kind of like the bypass, but it's a little bit different. They create a sleeve instead of completely rerouting everything. And then, of course, there is the banding. The least invasive and the more permanent, and I guess the easier. And none of it's really easy, but the easier with less future, I guess, doctor intervention, I guess, in my personal opinion, is probably the actual gastric bypass itself. So that's the one I've actually chose to do. Because the band itself, it actually requires quite a bit of maintenance and lots of routine doctor visits and stuff, and it's actually got to be adjusted quite frequently. And then there are complications with it. Once you get more active, it can actually flip, and they actually might have to open back up and readjust it internally. So, to me, that just seems like I don't want to have to go through all that, So that's why I'm kind of staying away from the band. And then as far as the other two, they're pretty much permanent. And you don't really have to go back in. They wouldn't have to open you back up for anything else. Everything that needs to be done is done on one shot. And they do it all laparoscopically. There's, I guess, a percentage of people that have to actually be completely opened up, if they run into some sort of complication, whether it be scar tissue or an enlarged liver or, something like that, where they actually have to get in and be able to see what they're doing a little bit better. But for the most part, I guess the doctor that I'm going to, he's got I think he said about a 94-95% laparoscopic rate. He does almost 95% of his laparoscopically. So, of course, that's good to know, because I'm not looking for a big hole, but I guess when you do it laparoscopically, they do about 6 or 7 small incisions, which I guess is a little bit easier to heal from, I would imagine, than one large one.
Wow. Huh. Well, good for you. Good for you. I mean, I know, people that know you, or, even people in the chat room here, we're all pulling for you, and we should definitely, touch base and, bring you back on the show here just to talk about that, as the time gets closer, because I know we're all cheering for you, and, that you're on track here for this summer to get that done. And I, personally, I've had a lot of patients that have went through that, and they feel good, and changes their life, and it's done them a lot of good. And in addition, it's helped them with a lot of their medical problems, whether it's blood pressure or sugar problems or whatever.
But basically, like I said, I go to the nutritionist. I go Monday, and then of course I'll go once in June, and then again my final appointment will be in July. And then probably 2 weeks after that final nutrition appointment, then I'll actually meet with the doctor again. And then, once we meet with the doctor, I think he does work and all that again, just to make sure nothing's changed since the first time I had blood work and stuff. And of course, if there's any other tests, like an EKG, things like that they have to run, that they can, take care of a problem before, any type of procedure is done. But yeah, I was going to ask him those types of questions, when I got to that point. But, just kind of, I thought I would take the opportunity and see if you had experienced that at all, and, how that works out. So that's kind of cool. Yeah, I'm cool with it. If anything I say, can encourage somebody else, or, maybe even, as I track my progress through the remainder of it, of course, I'm about, like I said, about 3-4 months away from actually being on the other side of after the surgery. And, granted, it's difficult up to the surgery, because it's a big lifestyle change. But really, once you actually have the surgery done, that's when the big change happens, because, you have to really learn how to eat again, and it's a whole, it's like starting to eat all over again, it's kind of like baby steps, so I'd be more happy to, if you ever have me back on the show, post surgery, or even, before the surgery, I'd be happy to more, to share what I'm going through or what I'm experiencing, and, whether it be negative or positive, I have no reservations about doing that. So,
all right.
Just,
Sounds good.
Yeah.